John Heron's theory covers 6 communication skills, which he believes are all very important when building interprofessional relationships. They are constructed to help and support a person, giving guidance and advice. There are 2 categories which these skills come under, including facilitated and authoritative intervention, as indicated in the chart. We will be focusing on informative intervention. This is a type of authoritative intervention which aims to give a patient information to enable them to make a positive, knowledgeable and informed decision. This is a very important skill when moving into areas such as nursing and physiotherapy, as well as a large range of other healthcare positions. You must be able to communicate with a patient in an authoritative manner without sounding overpowering, rude or threatening. When giving information, it should be expressed in a calm, gentle manner so the patient feels comfortable and confident with what you are communicating to them.
When using informative intervention, there are a few important factors you need to take into consideration. Facts. Being a nurse or healthcare professional, patients generally believe everything you say. Therefore, you must ensure that everything you communicate to them is genuine and true. Because if you don't, the patient will be misinformed and this may lead to severe consequences, as ACC does not cover health professionals giving wrong information. Skills. Some of the important skills involved are there to make sure that we know exactly whether the information should in fact be communicated and given to the patient, and if so, how much of that information should be shared with them. We also need to ensure that they are aware of the prediction and of the consequences of their actions. This is making sure the patient is informed of what could happen if they do or do not follow our instructions and what the result of this could be.
Some ways of using the informative intervention in a negative manner may include oversupply, giving the patient too much information so they feel overwhelmed; undersupply, not giving the patient enough information so they are unable to make an informed decision; incorrect, giving the patient false information so they are misled; inarticulate, giving the patient the correct information but in a way that they don't understand; also manipulative, communicating in a certain manner which persuades the patient to do something even if that is not what they personally agree with. Language must be appropriate for the age/stage of development. When using informative intervention, we must take into consideration a patient's stage of development. If giving information to a young patient, they will be at an early stage of development, so their cognitive ability and skills will not be fully functional yet. On the other hand, if you are communicating to an adult, they will be better able to understand and grasp the concept of what you are informing them of. However, do not assume they understand all the medical and technical terms you may be using when discussing it with them. So say it in a manner they can comprehend and be open to questions.
We also need to consider the Code of Patient Rights. The patient has the right to be fully informed of what is going on before they give consent to anything. It is our job as health professionals to provide the patient with enough information to make an informed decision. Confidentiality and security of patients' information is also another important factor that needs to be adhered to. Any information that a patient provides us with must be treated respectfully and kept private.
We will now demonstrate an example of how the informative intervention would be used in our professional practice. The characters in this role play include the patient, who is a 5-year-old child, the nurse, and a physio.
Hi there, I'm Victoria and I'm going to be your nurse while you're in hospital. Do you know why you're here today?
My knee hurt and my mum said we had to come to the hospital and make it better.
Yeah, that's right. So what we're going to do is we're going to get you all dressed in a nice dress, and you're going to give you something to make you feel quite sleepy, and then the doctors are going to